All right, we are going to go ahead and get started. Good afternoon and welcome to the Coldest Silence, Crystal Meth and the Impact on Black MSM. My name is Johnnie Kornegay and I'll be your moderator today. This webinar is being presented by the Counter Narrative Project in collaboration with Black Emotional and Mental Health Collective, or BEAM, and the Harm Reduction Coalition. It is our pleasure for you to join us today. Just some housekeeping before we begin. Participants will be on mute for the duration of this webinar. We will have a total of 3 speakers. You can engage us, though, throughout the webinar by asking questions. To ask a question, you want to expand the questions box that's right there in your control panel. You will want to type your question in the box below, and you will press send. I want to do that one more time. So to ask a question, you'll go ahead and expand your question box that is in your control panel. You will type your question here, and then you will press send. Thank you. As for our agenda today, I will do a quick introduction of our presenters. We will talk about our learning objectives for this webinar. We will specifically talk about what is crystal meth, risk factors associated with using crystal meth, methamphetamine use among Black gay men, and we will have 2 presentations. We will have a presentation from Justin Smith and one from Dr. Nathaniel Curry, and then we will have some time for questions and answers. I am grateful to have these 2 presenters with me today. Once again, our first presenter will be Justin Davis. Justin is the lead outreach specialist for Atlanta Harm Reduction Coalition. And following that, we will have a presentation by Dr. Nathaniel Curry, who is a clinician, consultant, and educator from BEAM. You will hear from both of them in a few moments. So, let's begin. Silence is a way to grin and bear it, a way to not acknowledge how much my life is discounted each day. Black men loving Black men is a call to action, an acknowledgement of responsibility. We take care of our own kind when the night grows cold and silent. These days, the nights are cold-blooded, and the silence echoes with complicity. Those are words from Joseph Beam. Beam wrote those words in his essay, Brother to Brother, Words from the Heart. It is our intention, it is our desire for this webinar that we turn the page as a community on the conversations about crystal meth and its impact on Black gay men. We intend to do this through truth-telling and stories. We will also do this by providing approaches and insight that can be applied as individuals or organizations. In short, now is the time that we speak up. Our learning objectives for this webinar are to provide information on crystal meth and its impact on Black gay men, provide service providers and community advocates with information and tools to serve Black gay men who use crystal meth, and to provide practical harm reduction strategies in service of Black gay men who use crystal meth. So what is crystal meth? Okay, so crystal meth is crystallized methamphetamine. It is a type of amphetamine. Amphetamines are a group of synthetic drugs that stimulate the central nervous system. According to the National Institute of Health, or the NIH, some of the common names for crystal meth include chalk, crank, crystal, ice, meth, and speed. Interestingly, though, not included on the NIH list, but quite prevalent in Black and Brown communities, is the term TINA, sometimes shortened to T. This is a term that can also refer to crystal meth. People can consume crystal meth in a variety of ways, including inhaling, smoking, snorting, or injecting. What are some of the things to consider if using crystal meth? Well, the first consideration that I'm highlighting here is the risk of overamping. So let's talk about this. So to overamp isn't necessarily to overdose. So let's define it. According to the Harm Reduction Coalition, overamping means a lot of things to a lot of people. Sometimes it is physical, when our bodies don't feel right. Other times it's psychological, like paranoia, anxiety, or psychosis, or some mixture of the two. It's complicated because sometimes one person will consider something overamping, and some other person actually considers it just part of the high, or maybe even a feeling that they enjoy, whereas someone else can hate that feeling. Another risk factor is sharing injection equipment. If sharing injection or snorting equipment, rather, there is an increased opportunity of acquiring HIV or Hep C. An additional risk factor, if using crystal meth during sex, there's an increased opportunity of acquiring HIV or other sexually transmitted infections. In addition, because someone may be using, there's also an increased opportunity for injury caused by friction during intercourse. In a 2009 study called Methamphetamine Use Patterns Among Urban Black Men Who Have Sex with Men, participants reported using multiple substances and used, on average, 9 days within the last 30 days. They spent an average of $159 per month on methamphetamine, and a median of $398 on all substances. So the frequency of monthly amphetamine use was related to the use of powder cocaine and alcohol, but not the use of other substances. So that's important to keep in mind. Black men who have sex with men primarily used methamphetamine in private venues. So that's important to keep in mind, such as homes of friends, and actually reported obtaining methamphetamine or crystal meth from multiple sources. Men who reported exchanging sex for methamphetamine reported greater use in public venues, such as sex clubs or sex parties or circuit parties. For more information on that particular study, you will see the link at the bottom of your screen. So now that we have provided some background information, I'd like to go ahead and introduce our first presenter. Justin Davis is from Detroit, Michigan. He started his journey in harm reduction and HIV prevention in 2013 while volunteering for the Muskogee County Board of Health in Georgia. He received his BS in health science from Columbus State University. He then ventured to Washington, D.C. To work for the Whitman Walker Health Center right after graduation, and continued his work in HIV prevention. He currently works for the Atlanta Harm Reduction, and I am so grateful and honored to welcome Justin Davis. Justin?
Hi everyone, how you doing? Um, so my name is Justin Davis, and I hold lead outreach specialist position with the Atlanta Harm Reduction Coalition. My job is amazing, and the model we use is very non-judgmental. We advise our clients that we meet them where they are, meaning we do not judge and we are only there to provide services that they need. I like to start my portion of my presentation by telling a story. My use with crystal meth would be a lot different from others, but I think the experience is definitely the same. When the drug was introduced to me, I didn't know how to react. I tried it because it was presented to me in such an enticing way. Those who have used this addictive drug know that once you hit it, your rational thinking goes out the window. T, as it was introduced to me during a sex session, I believe most of us use this drug during sexual encounters because it relaxes our body and increases your sexual desire, which is why so many people continue to go and go when it concerns sex, because it makes you very hypersexual. I knew nothing about crystal meth and the effect it would have on my mind or body. I would say that he did explain to me what the drug would do for me. He also made sure I need to brush my teeth after usage and not to inhale the smoke like I would smoking a blunt. The dude was very informative about the use of tea. I can only speak from my own experience, but I am pretty sure that it's the same across the board. This drug made me think irrationally and have no concern about my own well-being. Condoms were the last thing on my mind, and I didn't care about his HIV status. There it was, right in front of my face, the pipe that reminded me of a one-hitter for smoking marijuana. I hit it again and again until I felt this craving, this intense desire to swallow this man whole. I wanted nothing more but to please him no matter what the request was. A crystal meth high is long-lasting. It can be dangerous also around the wrong people. Needless to say, too, I had no appetite or desire to put anything in my mouth but him. He made sure I stayed hydrated so that I wouldn't pass out. This drug made me feel like I would do anything for him sexually with no limits. After my high wore off, I felt so drained and used. I came down alone, and it was exhausting. And I believe I slept for almost 2 days. This was the reason. There's that reason I vowed never to use this drug again, because it was a feeling I didn't want to relive. I thank you guys for listening to my story. And I feel like it was important to tell it because in order for us to understand the impact of crystal meth on Black gay men, we need to know how it feels in the moment. The moment when many of us want to feel something, the moment when so many want to feel anything. Like I said, my youth may have been different, but my experience is also the same as others. Okay, so my kind of work, what kind of work do I do? So again, I'm a lead outreach specialist at the Mental Harm Reduction Coalition. So I do everything from HIV testing to Hep C testing. I test for STI and I also do confirmatory tests as well for Hep C and HIV. And the population that I do serve would be, can I say MSM? Would be the MSM population between the ages of 18 and 29. High-risk population dealing with sexual encounters as well, drug users, sex workers, anything in that realm. And the nightlife in Atlanta, and why it's important to understand it, because to me, Atlanta is a melting pot for so many different races, people who identify with different sexualities, yeah. So to understand the nightlife, you have to understand that, not all MSMs go to clubs and bars. They also, like day parties or kickbacks. So I use what I know because I am an MSM. In order to reach that population, I try my best to venture out to make sure I'm reaching any and everybody. So how do I reach gay Black men? It would be because I am a gay Black man, and when I do my outreach, I definitely use that to my advantage. I make them feel very very comfortable to speak with me. I let them know my past experience and what I have and have not done. Usually they know who I am regardless because of what I did in my past, which is porn. So most of them know that I did porn. So it's kind of like a open dialect kind of, sort of. So it's like they ask me what I'm doing, I ask them why I'm here, and I kind of steer the conversation back to HIV. So it makes it very personal and engaging, if you ask me doing what I did in my past. It's very engaging for a conversation. I also try to reach them by making them feel more comfortable because I did those things, and that I am also a positive male. I tell them my own experiences dealing with HIV and, you know, how I got to that place and how and why I tried Crystal Meth. And yeah, how am I listening to these people sharing personal experiences? Yeah, sharing personal experiences with them. I use that as well. And then I try to focus on joy and laughter, because the reason I focus on joy and laughter is because when we discuss HIV, I feel like it's such a dark space for everyone, which has so much stigma and negativity attached to it. So I tell my clients or people around me, like, not to go to that space. I also try my best to make my clients feel comfortable, even if I have to tell an embarrassing story about myself to make them laugh. Joy to me is just a key component to living a healthy life. And even though I make sure to tell, even though we may be going through things in life, you're only going through those things for a moment. And I give them the option, and it may not be for everyone, but I give them the option, you know, at this very moment that you found out that you are positive, you have every right to feel how you're feeling, but don't stay in that space. That's usually what I do. And they usually when they leave me, they're smiling. It's like we're good girlfriends, honestly. And that's so I let them know, like, don't change your happiness. Like, don't let your happiness change that you found out something that you feel like is a death sentence, which is not, you know. Usually I let them know about support groups and the other things that we can go to that are other positive people in there as well. But it's always in their own time frame, if that makes sense. And we can go ahead and go to the next.
Justin, thank you so much for sharing your story and bringing in your experiences as it relates to not just the topic of crystal meth, but also talking about the intersection with HIV and your work. So thank you so much. And if you have questions for Justin, please feel free to use the Q&A box down at the end, and we will have a section for questions towards the end of the webinar. So you can go ahead and ask your questions now. So we're going to move on to our next presenter. Next, I'd like to welcome Dr. Nathaniel Curry. Dr. Curry is a psychotherapist, mental health and public health consultant, and clinical educator with over 12 years of social work experience, specializing in behavioral medicine and HIV prevention and post-diagnosis therapeutic intervention. He is a University of Pennsylvania graduate where he earned a Doctor of Social Work degree. Dr. Curry has experience in multiple clinical and social service settings, including Johns Hopkins Medicine and Chase Braxton Healthcare in Baltimore, as well as Us Helping Us and SMYAL in Washington, D.C., and the South End Community Health in Boston. Today, he is the director and co-creator of the behavioral health program at True Evolution in Riverside, California, a bilingual specialty practice providing therapeutic and empowerment services to lesbian, gay, bisexual, and trans populations, people living with HIV, and people of color. He is passionate and knowledgeable about social work education and clinical supervision, and on issues of equality, youth homelessness, and the intersection of Black men, mental health, and infectious disease. He joins us today through his work with BEAM, and I would like to welcome Dr. Curry to the presentation. And Dr. Curry, I will go ahead and move slides forward for you, so just let me know when you're ready, and you can take your phone off mute. Do we have you?
You have me. Thank you, Johnny. I appreciate that introduction. And good afternoon, everybody. It is lunchtime here in California, so I'm going to get right to the slides. But first, I actually wanted to say to Justin, thank you for sharing your story and your insight on your work. I really do believe that there's a healing power both for people who share their narrative, but also for people who receive it. So I want to thank you for that. If we can hit the first slide, please, Johnny. I would like to jump right into some of the harm reduction information and work that is associated with this topic. I guess I will start by saying that a lot of my work, while not necessarily focused on substance use and abuse in my work, in my healing work and behavioral health, crystal meth use is something that comes up pretty often for folks. And generally when I see people, it is in between use or post-use. And a lot of times people are sort of going through sort of a recovery cycle, but also a grieving cycle when it comes to their experiences. For a lot of clients who come in, there are, sort of the bits and pieces of their experiences using crystal meth, especially over a period of time, that feel traumatic and are associated with events that were traumatic or events that were low. And likewise, there are clients that come in and say a lot of glamorous things about their time, and that's why it is so dangerous for them. So I do think it's important to just recognize that maybe no one experience is the same, but that at the end of the day, I think people really want to begin a dialogue in our community, in the community. We've begun to do that. We're doing that with this project. We're doing that in our communities, our smaller communities, and we're starting to see in media more opportunities to have this dialogue. I think there was an article, I know there was an article that came out last year by Tim Murphy at The Body called Gay Black Men Confront Crystal Meth. You can get that article from thebody.com, and you could look that up. It was a great article that really started maybe a national conversation in media sources for our communities. And I believe that what Justin and Johnnie and I are doing today is just sort of, extending that dialogue. So I would encourage people to continue with safety and recovery through harm reduction. This is super important, I think. I want to recognize a couple of things before we get into some of the intervention tools that we can bring back to clients and to our peers. First, trauma therapy. Before we talk about harm reduction, there are some things I do recommend for folks. I do recommend that people who have a history of use or are currently using do address emotional and mental health concerns, their trauma histories, and healthy ways to learn and relearn how to have healthy relationships and attachment. A lot of times people are using as a way to sort of avoid or to fill a void where attachment is not. Oftentimes, use is associated with attachment, less sex. And so we want to sort of recognize that through coaching and therapy, that people can begin to just explore those sort of relationships and those concerns. Community support groups are a great way to generate connection for people. We know that people, clients and peers alike, are more successful and thrive when they feel like they have a sense of community or when they're a part of a community. So community support groups are a great way for people who maybe feel outside of the community to be brought in. It encourages empowerment, ownness of your story. So again, that aspect of, sharing your story, sharing your narrative as as a tool for healing, a tool for empowerment, and a tool for inspiration. And sharing your story could look like support groups. It could look like a blog. It could look like, real-time face-to-face work or conversations. I had a client today who said that, they, a transgender woman client who said this morning that, she saw a documentary of, college students who were trans, that were transitioning, and it inspired her to, begin her transition and still not compromise her education and her goals and things that she wanted. So, that was a way that sharing a story empowered this young woman. So there is power in that. One of the things that also comes up before we get to harm reduction interventions is, the idea of, working with our clients to disconnect sex from crystal meth use. I bring that up because several clients have said that they felt like, after use or after multiple use of crystal meth during sex behaviors or during sex experiences, that they really felt like a relationship was building between sex and crystal meth. And it was a relationship that started to grow and, marry. And it was really hard, quote unquote, to break up the relationship, and a lot of clients have said that, sex just became something that they associated with crystal meth and vice versa. And that includes, watching porn and masturbation. That includes, speaking about sex or sex. That means even times where there might be even sitcoms that would make jokes about sex and they would think about crystal meth use. So, that relationship is, steadfast, it's true, and it's something that we definitely want to work with clients to explore and hopefully disconnect. One client said to me that, abstinence did not work for him. It just made him want sex more, and then that made him want crystal meth more. So for him, it was about finding that balance between, generating new, healthy, sober sex and, reducing his, drug use. Other clients have said that in this sort of idea of disconnecting sex from crystal meth, that they've had to stay away from hookup apps, that, hookup apps were a constant trigger, even if they weren't necessarily looking for sex, even if they were on hookup apps to, form connection, to chat, to look for dates, to try to do more healthy type behaviors, which hookup apps can be good for. There are, meaningful connections that can be made from social media and from apps. And for a lot of clients, though, they felt like, as soon as they saw the emoji diamond in a profile, that it was a trigger for them to use, or as soon as they saw a party and play or a capital T in somebody's profile, it was a trigger for them. And so for a lot of folks, it was looking for other ways to form connections and attachments outside of, a hookup app or a social media source where it's a group of people in various parts of their life journeys. And some of those journeys include, active use. And then if you can, a lot of times folks will say it's been helpful for them, in addition to seeing a therapist, to address sobriety and to address mental health concerns. They've also sought out the help of a sex therapist when resources were available, so they could really work on generating new healthy relationships and substance-free sex behaviors. And if there's any questions about any of those, I would love to hear them. Can we have the next slide, please, Johnnie? Thank you. So harm reduction interventions. So I want to break this down into two pieces. So I'm going to give you what clients have told me that they have harm reduction intervention clients have come up with on their own, and which I think is very valuable. And then I'll give you some that clinicians have sort of brought to the table. And I think that, if we're talking about addressing behaviors in a population, I often will look to that population to sort of, give us the insight, give us the direction, and maybe even give us the actual intervention, right? I feel like people know what they need. We don't necessarily need to come up with it for them. So in terms of that, harm reduction interventions for those that have used and are in recovery, some of the feedback I've gotten from clients were look for new or clean needles. So, reducing harm, reducing opportunity for infectious disease by either carrying or looking for clean needles, seeking out sources through needle exchange programs, but making sure if it's possible to have, clean needles if you're using intravenously and to protect yourself that way. Be aware of your surroundings. That's a really great one that clients have brought to me. They said, they've depended on a buddy. They've depended on or buddy or two buddies that they are with at a party or at an event to sort of have their back and understand that your judgment could be compromised, your awareness could be compromised, and even your ability to recognize space and time and those sort of things that they may be compromised and that you will want to keep yourself safe. Not everybody has the best intentions for you, so they're aware of that. Drink lots of water. A client said that to me, and I thought to myself, well, that does make sense, doesn't it? And I believe Justin shared that in his story too. You don't want folks to be dehydrated. You don't want folks to pass out or to be left somewhere. So using what seems like a simple harm reduction intervention, bringing water or drinking water or bringing it with you, seems pretty simple, but it's something that it's important just to say. Sometimes we just have to say the words to people to, trigger behaviors. So that's a great one right there. Watch the syringe being prepared. If you're using intravenously, keep an eye on who's preparing a drug for you. Keep an eye on what is going into that syringe or what's being pulled out of a plastic bag. Just be aware of what's happening if you do choose to use. Again, these are harm reduction interventions, so we're not looking at making judgments about use. We're not looking at, getting people into rehabs or detoxes or telling them that they need to stop. We're looking at reducing the harm if you're going to engage in the behavior. And so that makes perfect sense. Look at the syringe, look at the person, look at the surroundings, and just be aware of what's happening. Decide for yourself how much you want to use. Don't leave that to somebody else. We've seen in the media times where young people have passed away or are deceased now because they allowed another person to, administer a drug, this particular drug, to them at the rate and pace that they thought that they wanted the person to use, and it has resulted in death or injury. And I'm thinking about a couple cases here in Los Angeles that stick out to me, where we've lost, young brothers who look like us and who are our peers because they allowed someone else to make these decisions. So understanding that perhaps while you're using, your decision-making is compromised, but also being very strong and steadfast about making sure that you are not allowing someone else to administer this drug to you, that you decide how much you use. That's a great one. Pass that on to your clients. Help them to become boisterous in that, help them to advocate for themselves in that, because we really just want to keep people safe. If you're going to use, we want you to be safe. Next slide, please. Harm reduction interventions continued. So from the provider standpoint, when we're working with clients and you've had these conversations with folks and you've given them all of the sort of interventions we talked about on the last slide, there are other pieces to this too that we are responsible for. Assess readiness. So contract with your client to use less or reduce numbers of days used instead of quitting. Some people are not ready to quit. If we're assessing readiness and someone is adamant that they don't want to quit, they don't want to stop, that they're not addicted, that it's just for fun, it's social, it's environmental. I had a client who was a bartender in some pretty well-known gay bars in California, and he said to me quite frankly that it was part of the environment. It was what was expected to do, and all of the other bartenders did it, and that was our environment. It was not out of the ordinary. It was not alarming, and that it was just social, and that's how it began for him. And so he said nobody could tell him not to do it because that's what was expected and that's what he wanted to do. So if a client says that to me, I can pretty much assess their readiness as they're not quite ready to, quit or stop using. They feel like they have it under control. So if that's the case, let's talk about what the reality is for your use. Maybe the reality for your use is, only once a week, or only a certain amount at this certain time, or only with these people that are safe, or only in the home because the home is a safe place. Assess the environment, the crowd you're in, so on and so forth. So just really working with clients to assess readiness and then set them up for opportunities where they have, a good hold of their decision making. Set clients up for success. So this one is probably a bigger thing than it is written here, but when we set clients up for success, we want to make sure they have all the tools, all the materials that they need to be safe, to be successful in reducing their harm and to empowering themselves. So we might provide safety and resource numbers. We might, in a session or in an interaction in the community with a client, we might, literally help them program the numbers into their phone, and maybe the title of the contact is, I need help, or I'm gonna pass out, and all they have to do is go to that, and it's saved in their favorites, and a resource number is there. Maybe it's a friend to pick them up, maybe it's a hotline number, whatever the client you think is the best or most appropriate, but making sure that somebody has access to help when they need it, and without barriers. So if your decision making is compromised, if you're exhausted, or if you just passed out, you can't think straight, you're not going to be able to look up help numbers or even numbers of friends. You might be disoriented. Whatever the case may be, let's set people up. So all they have to do is go to their favorites and click, hit one button, or say a word into Siri on their phone, and they can get to these helpful resources. Provide clients access to harm reduction materials like condoms, PrEP, clean needles, wipes, sanitary wipes so they can wipe their skin before they use. Justin was saying about brushing his teeth. Maybe that means people keep a clean toothbrush that's in a wrapper with them, or maybe they create a little fanny pack or something that has the safety materials in it. So I'm thinking about some of the harm reduction interventions in Philadelphia right now with heroin use, where outreach workers are literally bringing these, polyester made fanny pack type things that have clean needles, that have a granola bar, that have a small bottle of water, that have, sanitary wipes and things like that in it. And they're literally handing it out to people who actively use or are known to be using. And they're reducing harm in the community by making sure people have the materials, the tools, the resources to keep themselves safe. So that's something that you might consider doing with a client. And then linkage to health insurance resources. That's important too. A lot of folks who want help or just want to talk, or people who want to address mental health before they address substance use, whatever the case may be, a lot of people are uninsured or underinsured, or don't know where to begin, or it's not a priority for them, or they know it's something they should do, but they need to do something else first. If we have opportunity to link people to care and link people to resources, I like to do it in real time. There's a lot of times where I'll just sit with someone and sign them up for Medi-Cal right in my office. It's not part of the role of my position as a therapist, but I know if we don't do it now, you're probably not going to do it. So let's just do it. It takes 15 minutes, and then check-in calls and texts. If we know that folks are going to be out on whatever day, or that they use certain times, or if we just want to check in on people, maybe people aren't even using, maybe people are sober or working towards recovery. The check-in calls are really helpful. People feel connected to community when you check on them. And we know through research that adding a telephonic component to pretty much any intervention increases its success rate by about 20% or more. So adding that telephonic component, even to harm reduction, I'm sure would prove beneficial. So that's something that's helpful to do. And then during face-to-face conversations or telephone conversations with clients, it's really important to be present, to listen, to show empathy, to withhold judgment or panic or making your priorities the client's priorities. So if a client is saying that they don't want to stop or they have it under control or it's just a social thing, and you feel like you just want to save them, you just want to help them, you just want them to stop, recognize that those are your priorities and not the client. That we don't want to add to pressure or panic or stress for clients, that we want to support their decisions by providing psychoeducation, by providing harm reduction intervention, and by allowing them to make decisions. Fundamentally, clients have a right to self-determination. So if a client wants to use, that's their right. They have the right to self-determine. We also have the ability to support people. We have the ability to reduce harm and provide intervention. So we can do both of those things simultaneously. So that's sort of the end of that. I have time to do a case example if we like. Johnnie, what are your thoughts? We have about 19 minutes.
Yeah, if we could do about 5 minutes for the case example, and then we will move on to Q&A.
Perfect, thank you. So I had a client not so long ago who had troubles with his crystal meth use, and who shared with me, and this was a person who, again, I will keep him confidential, but who doesn't mind sharing his story. So I do have permission, I should preface by saying. And this is a person who used off and on for years and had points and times of sobriety and was pretty successful in his work in social services and other avenues and artistic avenues. And one of the things he would tell me is that, he really felt like his, crystal meth use really came out of, other issues. So he described to me that really being a part of hookup culture and, social media and hookup apps that really promoted this idea of unattached or disconnected or unconnected sex, that he was sort of exposed to that in his late teens, early 20s, and it was very much the norm for him. And he felt like well before there was crystal meth use, there was a lot of perhaps maladaptive or unhealthy sexual behaviors going on, and that the further and deeper he got into this, which isn't to say that hookups are a bad thing, because I don't believe that they are, but for him, just sort of that being his only opportunity to explore his sexuality or sex behaviors, or that's how he felt, that it sort of went from there. And he said it wasn't until he was introduced to the party and play scene through hookup culture that he began his meth use journey, and that his sex behaviors became more troublesome, they became more frequent, meth use became really associated with that. And he said for him that it was, it got out of control. It started to affect his relationships and his job. And for him, recovery was about changing his environment. It was about changing his, cognition. It was about changing his association of types of sex or sex acts with substance use. And he says that, that there were a lot of triggers for him, and distancing himself from a lot of different things and sort of relearning pretty much everything was helpful for him. So I know that sounds pretty is missing a lot of details, and I unfortunately have to do that on purpose just to keep his identity concealed. But what I like about this, sharing from this client is that it really helps us to continue to look at this ongoing dialogue about crystal meth use and Black MSM, and add to that dialogue the idea of different types of what may be acceptable acts or acceptable hookup culture environments and really look at, how those environments can actually be a place where we, begin harm reduction interventions, or we begin, including people into this, larger dialogue, and, looking at inspiration of people who have recovered and who are still working on their recovery today. So that would be that. And if there are other thoughts or questions, I would love to answer them, or go from there. Thank you, Johnnie.
Wonderful. Dr. Curry, thank you so much. Once again, for everyone, if you are interested in asking a question of Dr. Curry or Justin, please use the Q&A box and we will get to questions momentarily. Justin, I want to start with you really quickly. There were a couple of harm reduction, there were some material pieces that Dr. Curry just talked about, and I wanted to know, in your work, does that align? Do you have some of the things that you use, like what Dr. Curry was talking about, instead of in terms of providing them to clients?
I do want to thank Dr. Curry for that as well. I do want to shine a light on what he said, setting our clients up for success. I totally agree with that, because from the standpoint of a harm reduction, we don't want to scare our clients away. So more so trying to build that relationship with them. We actually came up with a safe sex worker kit for people in our community. We talked to a couple of sex workers, and we actually asked them what do they need when it comes to safe sex to protect themselves. So we came up with like a safe sex worker kit. We provide razors, shaving cream, wipes, condoms, lube, and a pregnancy test. We put all that in the packet for them, and then we actually give that to them. We know where they're located. And my job also, we came with this thing called at-home testing. So some people don't really feel comfortable, coming to, I guess, certain clinic areas or certain areas. So we actually came up with the whole idea of bringing the test to you. So if you want to get tested on the corner of Peachtree Industrial or wherever you're located, we'll actually come to you, test you, and we'll give you your results right there and then. We also do at-home testing. So that was a big thing for us, to try something new to reach people in harm reduction. But I did want to say that was great, keeping that light, making sure that we shine light on setting our clients up for success. We don't want to feel like we're making judgmental thoughts or all that on them. But yeah.
Wonderful. Thank you so much for that, Justin. And Dr. Curry, I have a question for you. And Justin, I do want you to chime in on this as well. But Dr. Curry, I'm going to start with you. What advice? So, in thinking about this particular webinar, we really wanted to be able, like I said, to turn that page and really begin to speak up about crystal meth in our community. And my question for you is, what advice do you have for us to begin having more dialogue in our inner circles about crystal meth? What tips would you provide?
Thanks, Johnnie. I would say, well, what comes to me quickly is, just speak up. I think you need to speak up. I think there's a wave of, folks who are ready and willing to speak up about sort of the deficits or the unspoken things in our community, and create a dialogue, if not, a change in the community. And I think for me, it is a lot of what we need to do, I believe, is, empower folks in our community who don't necessarily have an avenue to speak up or speak out, or to say I need help, or who have been affected by, the stigmas of accessing mental health, accessing, substance use, or who, don't want to make a mistake, who want to continue to, please people, or have a fear of failure. And I think if we can just sort of take the pressure off people, that, it's okay to mess up, it's okay to explore, it's okay to, look at yourself and say, this isn't what I thought it was, or this isn't what I meant it to be, or, It's okay to have these sort of revelations, and it's okay to ask for help. It's okay to seek services. I think there's still some barriers we need to break down and allow people to sort of live out loud and live, maybe a little more boisterous in terms of their experiences. I think I would offer that off the cuff.
And Justin, what thoughts do you have in terms of starting that conversation within the community?
I definitely agree that we have to start speaking up about it, because I will say now, since I had a couple of trainings like a month or two ago, I usually ask that question now, because that's not really the questions that we usually ask people. Do you use tea, or have you ever tried crystal meth? I think one of the main questions on our forums is, do you do drugs? But no one's really going to say, oh yeah, I do tea, or I do crystal meth. So I think speaking up and speaking out about it will definitely knock down a lot of barriers, especially if you make a person feel comfortable about it. But yeah, I think that would be great.
Wonderful. Thank you so much for that insight. And I do want to jump into a question that has come into our question box. And I'm going to go ahead and read the question. We may not have an answer to this question on this particular webinar, but Dr. Curry and Justin may be aware of something that exists. But this individual said, thank you so much for the dialogue, but acknowledges that their question is heavy. And the question is, do we know if there's any correlation or any studies done between TINA use and suicide or depression? They've known 2 people in the last month who have committed suicide, and know that they were also regular TINA users. And another person that this individual knows that knows someone who uses TINA who suffers from depression. And the question is twofold. So are there any studies, one, and is there a correlation between crystal meth use and suicide ideation or depression? Dr. Curry, I'm going to have you jump in first if you're aware of anything along those lines.
Sure, there are articles that have been published in different, psych resources or sobriety substance use resources that definitely talk about crystal meth use and the fatalities, and fatalities include suicide. So I think for folks, it is important to recognize that people who use meth are more likely to have suicidal thoughts and to attempt suicide than many other substance use. Suicide is always a risk for people who are engaged in substances. I also think that there are times where people are using crystal meth use as a way to sort of treat themselves or self-medicate, and for things like depression or anxiety, and they like the way it feels. It's an escape. It's fun. It's exciting, and all those things are what depression is not. So, but if we talk about depression specifically, suicidal ideations are symptomology of depression, right? And so we can begin to connect the dots just sort of based on what we know right there. In terms of specific articles, I'd have to look them up, but I can tell you that if you Google right off the bat, crystal meth use and suicide, you're going to get a whole bunch of hits, different types of articles, some peer-reviewed journals, and some clinical opinions, and some experiences that people have shared.
Thank you so much, Dr. Curry. Justin, do you have anything to add?
No, because I can't really say that I know anyone who's been depressed and used TINA, so I can't really speak on it.
Wonderful. Thank you. Thank you so much. And I want to graciously thank everyone for joining us on the webinar today. It has been amazingly informative. I want to thank Dr. Curry. I want to thank Justin for joining us for the Coldest Silence. And we must continue this dialogue within the community. So thank all of you for joining us this afternoon, and have a great day, everyone.
Thank you.